I'm Steve Main with Fitness for 5, FF5. I'm here with Dr. Nario again of Biointegrative Health Center. How you doing, Doctor?
Pretty good. How are you, Steve?
Great, great. I love this series. Topics are always so good. So today we're going to talk about what's called a liver cleanse. So it's PPP. So what is PPC?
So PPC is an abbreviation for phosphatidylcholine. And phosphatidylcholine, these are cell membranes or walls around our cells. And embedded on these walls are proteins, receptors, channels where electrolytes pass through, sodium, potassium, and they're built with cholesterol. And it acts as a toll gate. I guess that's a better way to remember this, wherein it regulates the entry and exit of nutrients, electrolytes through our system. And imagine if there's no toll gate, there's just free entry of everything. There's chaos, no systematic process, meaning the good and the bad nutrients or foreign materials just comes freely in our cells to destroy our DNA. That's the function of phosphatidylcholine. It's a protective barrier for our cells. And at birth, our cell membranes are built of 90% phosphatidylcholine. And as we age, this decreases. But and again, how protective is it? It's not just one layer around our cell. It's two layers just to protect what's in the inside of that cell. The thing here is this layer that I was talking about, it's a liquid crystal semiconductor, and it signals the cell to let in the good and push out the bad.
So you talked about as we age. Does that mean that our cells get damaged as we age, or because I'm kind of sensing that this has something to do with damaged membranes? Mm-hmm. So how do we do damage to our cells or to our membranes?
Right. So when you talk about how do we damage cell membranes, how do we damage phosphatidylcholine in our walls? And that's a good point that you brought back aging, because as we get that 90% from birth content of phosphatidylcholine in our layers, as we age, probably there's going to be 10% left because of all that came in to destroy it. And what are these things that destroys that? These are free radicals. These are toxic substances such as heavy metals, detergents, even mechanical procedures that pokes around. For example, you got into an accident. It breaks blood vessels. It breaks cell membranes as well. High blood pressure. Imagine that pressure going through your veins and arteries, just destroying cells left and right. Increased adrenaline, aldosterone, and even cortisol, all these hormones that are responsible for blood pressure regulation. And blood sugar, when we have diabetes, this destroys more cells, as well as smoking, cocaine, even bacterial infections. Overall, everything that I just mentioned, it's all about the inflammation that gets induced, thus destroying these cell membranes. And the final end product of these would be scarring, formation of plaque, formation of clots, cell malfunctioning, cell death, and even organ dysfunction.
Okay, so it sounds like this would kind of be a benefit. The PPC would kind of be a benefit. I mean, I don't know. I'm not the doctor, but it's given me this question that it could benefit someone who has some type of heart disease. Maybe it would help clear that up a little bit. Or, what conditions would you use this PPC treatment for?
There's so many. There are various applications of these. And the thing here, just to name an important few, would be, as you mentioned, it's good for cardiovascular health. It helps lower down bad cholesterol and also triglycerides. and also increase the good cholesterol. In what way? It stimulates the liver to process all these bad ones and to promote creation of the better ones, the good ones. And it also increases the glutathione levels in our system. Stimulates the liver. Liver is the one that creates glutathione for us. And it also lowers the clumping of platelets, wherein it's making it more slippery, thus lower chances of clumping up. And this also, of course, if they clump up faster, you would have a higher chance of heart attacks and strokes. And also it lowers down the inflammatory enzyme creation of cells to calm them down so that less inflammation is better for your body. And increase also the membrane functionality of your immune system, because it focuses on enhancing the white cells, the lymphocytes, the macrophages, the monocytes. And you mentioned about heart repair. It does do that. And cardiac abnormalities, even on EKG, have been seen to be corrected by phosphatidylcholine. And it also improves exercise tolerance. Again, another good function of this would be for patients who has gastric ulcers. The lining that we have in our stomach, it's composed of a fat layer. That's why we're protected from ulcers and all these infections such as H. pylori. And the gastric lining is being rebuilt if you actually give phosphatidylcholine. So maybe a summary of this would be, imagine every organ that actually contains a cell. Any part of your body that has that will benefit from phosphatidylcholine. It's just, in general, it helps everything in your system.
Okay, so it's called a liver cleanse. I mean, some of your description there, I can understand that why it's called a liver cleanse, but can you just kind of elaborate on why this is called a liver cleanse?
Right, and again, I just wanted to emphasize that the liver cleanse is actually more of a moniker. It's a nickname, but behind that, actually, there are better functions for PPC. And liver cleanse is just the more famous term for it, and it's been known all over. And why was it called a liver cleanse? Is because of the liver effects, the benefits that it gives to the liver. I just mentioned a while ago the increased production or stimulation of glutathione from the liver. But it also prevents and postpones liver cirrhosis for those chronic alcoholics. It inhibits the scarring, the tissue scarring of that liver in order for it to regenerate. It also helps with viral hepatitis to lower the viral load that's being processed by the liver. Also for fatty liver, for the ones who has cholesterol issues, as we all know, they get all stuck in the liver and the liver cannot metabolize it. PPC helps metabolize and gets rid of that fat out of that liver. And also for somebody who has abnormal liver enzymes. So you get that in a blood test. Most of the time, we give them liver cleanses or PPCs to normalize that out.
Okay, so last question. Is this safe? How safe is this? I mean, in your body, you know?
Right, very safe, but in the hands of professionals, again, as I always say, these are IV therapies that need special training. But done wrong or infused too fast, this can actually cause vein inflammation, irritation, or even pain. And also, it can also drop the blood pressure. In rare cases, there would be allergic sensitivities. But again, you have to factor in the actual quality of the medicine, where you get it from, who's the provider giving it to you, and it all boils down to the experience of your provider and the competency. Again, we have done this for 30 years, and it's definitely something that we do in our area or in our specialty.
Okay, thank you, doctor. So that's Dr. Nario at Biointegrative Health Center. You can look them up online. They're in Reno. I'm with Fitness for 5. You can check us out at fitnessfor5allspelledout.com, and we will see you next time. Thank you, doctor.
Thanks, Steve.